Department of Health is warning residents of southwest Utah the 5-county district could see a surge in coronavirus cases. Today they announced 11 new cases in southwest Utah, bringing their total to 271. But local public health department says that the region is well prepared for a surge, and they are reiterating that their goal is not to stop the spread of COVID-19, but protect the most vulnerable. ABC4's Katie Corrales reports.
Now, during Wednesday's COVID-19 press conference, Governor Gary Herbert had a message specifically for southern Utah, saying, quote, "The simple answer is we're not back to normal. All of us have a responsibility to do our part." At the beginning of May, southwest Utah reported a little more than 100 confirmed cases. But in the 2 weeks that followed, the region more than doubled its total.
The increase in positives does not seem to be linked to the increase in testing. We're actually seeing an increase in the percent positive there as well.
State epidemiologist Dr. Angela Dunn is asking the community to be more diligent in terms of social distancing recommendations and following public health guidance. Health experts in southwest Utah say that although the district saw its biggest ever one-day spike and its 4th related coronavirus death this week, they say that overall they're well prepared and have given healthcare systems time to ramp up in the event of a surge.
Going back up in the phase, back up to orange is always on the table if that were essential. Right now we think things will be able to be managed as far as handling any moderate surge in cases.
David Heaton with the Southwest Utah Public Health Department says that the majority of cases can be traced to a known positive contact, whether that's a family member or coworker, adding that 3 of the 5 counties, Kane, Beaver, and Garfield, have no active cases. And when it comes to their ultimate goal, protecting the most vulnerable, the health department believes it's still doing a great job because only 1 resident over the age of 80 has contracted the virus in southwest Utah. Health officials say that doesn't mean, however, that anyone should be letting up on social distancing or mask wearing.
That just like orange, the social distancing is essential.
Because they say the virus can rapidly run its course throughout the communities. Reporting in St. George, Katie Corrales, ABC4 News.